Hi, my name is Harvey Bravman. I'm the host of Brookline Hub in Depth. I'm a video producer, filmmaker, and publisher of the nonprofit online publication BrooklineHub.com. We'll be coming to you each week with impactful interviews on the important people, organizations, and subject matters that affect the Brookline community. I'm very honored today to have as my guest Select Board Chair for Brookline, Greene, who is also the chair of the Brookline Select Board's Committee on Policing Reforms. Michael Zoorob, who is a PhD candidate in the Department of Government at Harvard University School of Arts and Sciences. And Dr. Elizabeth Childs, who is a former Massachusetts Commissioner of Mental Health and a child, adolescent, and adult psychiatrist, and Ronald B. Wilkerson, who's the Senior Business Intelligence Program Technologist at Boston Children's Hospital. Thank you all for being here with me. Bernard, I'm gonna start with you as the chair of this commission. And first off, I'd like to thank you for your service to Brookline, especially during the from the start of the pandemic till now. You and other volunteers and public servants and town employees have gone above and beyond since this pandemic started, and I thank you for your service.
Thank you for saying that. It's been a very difficult time, but it's shown the commitment and the incredible hard-working abilities of town staff and others.
You chair the Select Board's Committee on Policing Reform. This committee was formed after the horrific murder of George Floyd at the hands of Milwaukee Police Department officers. And at the same time that your committee was formed, a task force was formed that was chaired by a select board member, Raul Fernandez, that is the task force, I believe it's called the Task Force to Reimagine Policing in Brookline. If you could tell us a little bit, or tell me a little bit about your charge, your committee's charge, and how you went about your business, and if you could briefly the conclusions that your committee came to.
Okay. The committee was set up to look at policing from the standpoint of what reforms to the department would be appropriate to improve the department. I mean, the presumption was, Brookline Police Department is not a bad department in any sense. It's a very good department. It's not perfect though. And, the idea was to find or to determine, what improvements can be made to make it even better. And this is really the continuation of actually 3 decades of efforts in Brookline to evolve and reimagine the police department into a department that reflects the sort of progressive ethos of the town. We've been working on this for a long time, and especially with the coming up to Brookline of Chief Dan O'Leary, we've been really accelerating efforts to develop the type of department that can minimize. You can never reduce or eliminate, never eliminate, but minimize the risk that the department would have incidents of misconduct that are like the ones we see on the news. It started out, I mean, I'm not the expert on the history of this, but I think one of the things that was the motivation in the beginning was the perception by many, particularly Black and Hispanic people in town as well as surrounding areas, that they were being over-policed in terms of vehicle stops. Dan O'Leary began to do something that was kind of unique in the Commonwealth, if not the nation, and that is keep data on the number of stops, on police stops by race and gender and other factors, and then analyze that data and use it to intervene and try to reduce the disparities that were found and reduce unnecessary police stops. Now, it's not been perfect, which is why we still are working to reform and reimagine, but it did create or did cause significant improvements in the police department's operations. But we still need to work on the perception in many communities that things have not changed. But that's another story. Our committee looked at the operations of the police department in a number of areas. For example, the area of civilian oversight of policing, which in Brookline, as in many communities in Massachusetts, is done by the select board. We have the power of police oversight, but it's not a perfect, it's not a power that is perfect or is actually implemented in a necessarily complete way. So one of the recommendations, and Michael Zoorob will be able to talk about this in greater detail because it was his subcommittee that developed this, is to create a police commissioners advisory committee. Calling it police commissioners advisory committee because the select board is the police commissioners of the town of Brookline. It gives us significant powers, not over the day-to-day operations of the police department, and that's actually an important point, but over the general policy direction of the police department, the hiring, firing, and disciplining of officers and other things. So, the police commissioners advisory committee is set up designed to assist the select board to exercise its powers and to provide a forum for citizens to speak their mind with respect to how policing in Brookline is done. That's among other ways through a new police or citizen feedback form that Ron Wilkerson actually thought up and devised that makes it easier than filing a formal complaint for citizens to express their experience or make their experiences with police encounters or interactions known to the town so that we can review and analyze those interactions and make whatever changes may be necessary. Let's see, Elizabeth Childs I asked her to participate in this program because her subcommittees dealt with another very important issue, and that is the belief in many parts of the community that police are called to do things that other people like social workers or other social service workers are better trained to do. Now, there's some truth to that, but there's some untruth to it in the sense that many of the calls that we send police to really are so potentially risky that they don't really lend themselves to a social worker or some other clinician being the sole party responding to the call. But what we can do, and what the Brookline Police Department has been doing for quite a while, including with an in-house social worker that we have, is to where there's a call involving a mental health crisis or a substance use crisis, the police department will go out using its skills in de-escalating situations and its knowledge of how to deal with these situations because of its crisis intervention training and other training, to stabilize the situation, then give either a social worker or a social worker in the police department an opportunity to do follow-up, or in a situation where it's really an emergency, to call in a service that we have that's available to Brookline called the Boston Emergency Services Team, to come in and provide assistance so that the person that's having the crisis can be, their issues can be addressed, not necessarily long-term, but at least in the immediate time frame. So, Elizabeth's subcommittee worked on those issues, and she has a lot of very interesting ideas that hopefully we'll get a chance to talk about here. And before we go, I'd like to sort of talk about the makeup of this committee. I intentionally organized the committee to include both racial and gender diversity, but also diversity of life and professional experiences, and a diversity of viewpoints. And I call that creating creative tension in the deliberation, so that no one gets into, or no one engages in sort of preconceived ways of thinking, that everyone's ideas can be challenged, so that we reach a better understanding of the issues that's not based on maybe our own biases or our own life experiences. So our members included individuals who have had negative experiences with police, and a member of the police department. It included individuals who are deeply involved in Democratic politics and deeply involved in Republican politics. I'm a Democrat, but I'm willing to listen to the other side even there, as long as they're not really off the wall. But individuals who are ardently secular, and then individuals who are involved with faith institutions that inform their approach to policing reform, as well as other things. And of course, individuals with technical and research skills and understandings that I don't have, including people doing current academic research in policing, and individuals with a range of professional experience and expertise, including a lawyer who has litigated civil rights cases against police, a retired judge who has presided over such cases, and lawyers long involved in social justice litigation and client services. And as we have here on this program, a former commissioner of the State Department of Mental Health. So I think that variety and diversity of experiences, viewpoints, and approaches, really made our committee able to look at the issues of policing, from a variety of standpoints, and maybe, hopefully come up with the type of recommendations that wouldn't otherwise we wouldn't otherwise have come up with. So.
Dr. Childs, in going over the Reimagining Police report and interviewing Select Board Member Fernandez, a lot of their conclusions centered around when social workers, in their view, should respond to situations, and when it should be a police officer. And it seems like what your committee worked on, and what your expertise is That exact question, do I have it right?
Yes, yes. Thank you, Harvey, so much for having us on here. And it's been a real privilege to work under Bernard on this committee and to work with all my colleagues there. It's quite a wonderful group. I had the privilege of working on the mental health and substance misuse, substance abuse disorders. I think it's important to remember that what we need to think about is what will work in Brookline. There are lots of models around the country, but we're focused on Brookline. What would make our community live and work better together, including all those people who do need assistance for mental health or substance abuse. And the Brookline police get about 3 to 4 calls per day for community intervention. One of those calls per day is for mental health evaluation. So it's about 1,500 calls per year. So it's not a huge volume, but obviously every single person needs to be handled with expertise. And in order to address this, the Brookline police have trained 100% of their officers in de-escalation, which is quite unusual. And it has made, because of that, they were chosen by the State Department of Mental Health to be one of 5 training sites around the state in this particular type of community intervention approach. We do have, as part of that, one full-time social worker embedded in the department, but that person is spread very thin, as you can imagine. And the idea of expanding that would be a good idea, not only because it would be more expertise available immediately to the officers, but it also helps set up programs afterwards. And then the officers have a very good relationship with the Boston Emergency Services Team, BEST, which is one of the 21 mobile crisis teams across the state who respond with a master's level clinician within an hour to evaluate a person and then facilitate their disposition and aftercare. So that linkage is very strong in Brookline. And truly in Brookline, the crisis response front end is not our biggest problem. Our biggest problem is the aftercare, making the linkages for those individuals who have had an intervention with the police, but need help in accessing ongoing treatment, getting a bed somewhere. They go into emergency room and they refuse to be admitted, and you can't really keep them against their will in Massachusetts. We are a patient rights driven state. It is very important to us that patients choose the kind of care that they receive. So some of those people then come back into our community. So how do we help those people who need that ongoing help and assistance? And it's really not fixing the crisis end of the problem. It's the front end crisis. It's fixing the back end of the aftercare follow-up, which then leads to another crisis. So it is actually, if you think about it like a circle, you're trying to intervene at the place where Brookline has the biggest problem. And one thing we could do there would be to increase our social work capacity by 1 in the Brookline Police Department. So you have another person to help make those linkages, assist those individuals into following through with treatment. And also, it's an opportunity for Brookline as a town to have a public-private partnership with some of our really terrific healthcare providers in Massachusetts. For example, Boston Medical Center is the best team's entity. They have the best team as a provider for them. And we could work with them or any other really great institution, creating more capacity in Brookline for aftercare follow-up for these individuals. As you probably know, Harvey, the failures in the mental health system are due to difficulties with access, follow through. They are caused by many complex factors, but our police department end up being the first and last responders because of the gaps in the existing behavioral health system. And so to think about them not being there would actually pull one of the supporting beams of the whole behavioral health system out. I mean, how many times do we call somebody and we hear, if you cannot reach me or get an answer, call 911. That's what medical doctors do, psychiatrists do. In fact, about 1/3 of the calls that the Brookline police get are from mental health providers asking for help with people that they are worried about. So it's quite important that we keep our police in the loop of that first first responder crisis element. And then there are the issues of dangerousness. I mean, there are some cases where you really, even no matter what the system is, when somebody has the risk of being violent, aggressive, medically unstable, needing an ambulance, or is unwilling to cooperate with an intervention, the police are involved for any system around the country.
Dr. Childs, so would the social worker then go on the call with the police officer? Is that how it would work?
If it is safe, yes. If it is safe, the social worker can go, or the social worker can go and hold back until the police officer has made sure that the situation is stable. It is not responsible or realistic to send a social worker into a situation where we don't know if there could be an unregistered firearm, for example. That's just that's not what social workers are trained to do. And so we need to make sure we also take care of our staff, that they're protected as well.
And Ronald, explain a little about your role in this. Senior Business Intelligence Program Technologist is all I've gotten from that is that I'm totally intimidated.
Yeah. Okay. So
I've known Ron for a long time, and I don't know what he's.
Yeah. Okay. No, it's a mouthful. I mean, think of it as a data scientist. We analyze clinical data and some operational data to try to come up with ways of improving operations to aid clinical research, to aid quality management within the context of Boston Children's Hospital. That's basically the idea. So it operates out of the Information Technology Department, and it makes use of something we call our data warehouse, which is a consolidation of data from many different clinical and operational administrative systems. And we try to do things like both retrospective analysis and predictive analytics on situations to try to improve things like patient flow capacity, even doing things like going back and seeing if there are patterns in particular kinds of diseases, population health kinds of things, those kinds of things. So that's what I do. I'm basically a data geek.
But tell Harvey how those skills are used on the committee, because I mean it fascinates me, how something that was way over my head, but was so important to the committee's work.
Well, I mean, to a certain extent, there's a limit to what you can do without data. And so the first thing that came to my mind when we started the work is, okay, what evidence do we have for various kinds of things, for various kinds of situations? And where is that data kept? So a certain amount of, so one of the first things I did is I inquired with the police department and the town IT department, okay, where do you have data on things like traffic stops, volumes of phone calls, those kinds of things? And I ended up interviewing with I'll say data folk in those places to find out what we've got and what we don't have. So the and where that and who's and what data exists and what people are doing to analyze it. That's pretty much what we came up with. So we discovered that there was a certain amount of data there. I mean, there is software in the police department for tracking a lot of data, but it's not necessarily oriented towards the kinds of in-depth analysis that we want to do. It's more oriented towards kind of immediate operational kinds of things. Sometimes you have to organize data very differently if you want to do historical analysis. So those kinds of things were not necessarily there. Another thing has to do with how civilians feel about the police in Brookline. So there exists a complaint form and there exists a commendation form on the town website. It turned out at the time it was much easier to file a commendation than a complaint, which I think which we found very interesting. But actually in Brookline, there were only like 8 or 10 complaints a year, which is not very much, and it doesn't give you much to work with. So So one of the things I suggested was, look, if we really want to get good feedback on a on a public-facing department, the way it's done in healthcare institutions, on for retailers and that kind of a thing, there, what if we had a feedback form, just a regular civilian feedback form, so that whenever anyone interacted with the police, they could go online and kind of say, okay, how did we do? Were you satisfied? Were you dissatisfied? Were there problems? How do you feel about that? So I kind of floated the idea of this civilian feedback form, which we developed and which we're actually in the middle of deploying right now. And the idea is going to be in various places on the town website, the police department, the select board, and we're also going to deploy on social media like Facebook and Instagram, where people can say, hey, if you had an interaction with the Brookline police, what was it like for you? You know, when did it happen? What was it good? Was it bad? Uh, Indifferent? It didn't even have to be direct interaction. It could be an observed interaction, but we're hoping to get a whole lot more data on how a wide variety of people perceive the police department, and use that as a way of picking up problems where they occur. So there's that. Another thing that we care about is um, a lot of the feedback about traffic stops, for example. We have a certain amount of information about traffic stops. One of the things that turned out to be difficult was deciding in looking at which people were stopped, had to do with, okay, most of the people stop people who don't live in Brookline or passing through Brookline. What is the ethnic composition of the people who are actually passing through Brookline? How does that relate to the ethnic composition of the people who have traffic stops to get tickets or whatever? And it turned out we don't really have great data on that. The closest we've got, which was much better than nothing, was to look at rush hour traffic passing through Brookline, because for a completely separate reason, the traffic department cared about the rush hour traffic flow. And looking at that traffic flow, we could see that a lot of the rush hour traffic was from suburbs that were even less ethnically diverse than Brookline, and Brookline is not that ethnically diverse. But for example, an unanswered question is, are most of the traffic stops happening during rush hour? What about the traffic that's going on at very different times of day? What towns are those coming from? We don't have that information yet. And one of the things that would be very important to help give us a good, I would call it a denominator, a baseline for knowing what's going on, would be to collect that data in addition. Another aspect of this is even when the police do traffic stops or write tickets, they write the stuff down by hand. And to get the data in an analyzable form, somebody has to take those handwritten notes and type them into a computer, and which is very, very time consuming. And we're also not even sure that all the data that's collected there is all the data that's relevant. So one thing that would be very, very, very helpful is some automated way to collect more comprehensive data, automated ideally, but at least have someone who can do comprehensive data entry, so that we can really kind of take a much closer look at what's going on there. So those are the kinds of questions that I automatically think about because I'm a data geek, and which came up in the course of working on the committee.
Bernard, maybe you can answer this question. What's the level of recording, either video and audio, of police interactions at traffic stops or anywhere? What I'm thinking is, from some of this data that we're analyzing, the one thing that you can't get is what is the attitude, or what is the tone of voice, or what is the, how that interaction plays out with the individual.
Yeah, we don't have that type of data. We are looking at giving officers cameras, body cameras, and cameras in the vehicles, but that's a ways off. And actually, that's a nice segue to Michael Zoorob and the Police Commissioners Advisory Committee, because that committee, among its many tasks, will be to help the town and help the select board to make some decisions with respect to body cameras, because it's not as easy as sometimes it sounds. There are a lot of issues both from privacy issues, not of the officers, but of the citizens who are being filmed, sometimes in their homes. So the PCAC, it would be perfectly suited to address that, but it would be doing a lot of other issues that I think Michael can talk to us about.
So as Bernard mentioned earlier in this conversation, in our community, the select board are the police commissioners. State law puts them on the top of the hierarchy, on top of the police chief, who they, basically choose to hire and fire if so needed. They're the boss of the chief. They implement the policing policies under state law. The police department can't institute policies without select board approval. And they're the people who can hire and fire police officers and are the ultimate appointing authority for disciplining officers. So in our community, the select board, they are 5 directly elected civilians who are tasked with overseeing the police department. What our observation is that the select board has, as I'm sure is no surprise to many people, a whole lot of other responsibilities too. And they simply lack the time and the specialization and to some extent the expertise, although, the select board is a body that changes over time, so it never has the same exact expertise at any one point, to really devote themselves to exercising their full civilian oversight capacity and role. And so we devised the PCAC with, a pretty extensive charge, basically, to both provide a liaison role between the public and the police department, to be a group of people who are not police officers, but who are deeply engaged with policing issues and also deeply receptive to feedback from the public about their concerns and perspectives. And also to sort of, be umpires or ombuds people who are really actively overseeing policing policies, studying what the police do, what other communities do, and formulating recommendations to the select board in order to implement those policies as necessary. And so, there are a variety of different ways in which this can happen in practice. In Massachusetts, as in many places, a lot of how policing is done is shaped by collective bargaining with the police union. And so one role that the PCAC has is to actually think proactively about what the town wants to achieve in those negotiations with the police union. What changes to the work environment for police officers, for example, to police discipline, or to something like body cameras, to echo that example that Bernard mentioned. What exactly do we want to achieve in those negotiations? And what does the public want us to achieve in those negotiations? And the PCAC would have a role in thinking proactively and hearing from the public about the priorities that the select board should bring to the table, so that we are, really being thoughtful in how we can implement changes to policing policies. So that's just one example. Another way in which the select board plays an important role as police commissioners is that they have a very important role in seeing or overseeing the civilian complaints process. So in our current complaints process, the select board is involved in a few different ways. They appoint people to review the process regularly. They are supposed to help publicize the process, and they are the mechanism for people appealing complaints that they feel were investigated improperly. And, we studied how this process has worked in practice and thought that, it would benefit from having more active attention from people who are focused more specifically on policing issues. By the time that the complaints would get to the select board, they would basically get an investigation from the police department and a report. And that's pretty much what they had to work with. And we thought that by having the PCAC involved at an earlier stage in the process, that would provide an additional kind of independent perspective on how civilian complaints are overseen. And so the PCAC would have a role in reviewing complaints, basically. not only reviewing them for patterns after the fact, but also reviewing the investigations while they're happening to make sure that all the proper evidence is collected, that the investigations are done in a timely manner, and that the weighing of evidence seems fair. And if the PCAC determines that none of those, if the investigation was inadequate for whatever reason, they can instruct the police department to make changes to that investigation. And if that's still not satisfactory, they can tell the select board. And the select board, as this discussion, as I mentioned at the start of this discussion, the select board really formally is the boss. And so if it's necessary, the select board can hire an external investigator and just do it like that. It may not, in many cases, require that kind of external intervention. As Ron mentioned, we have relatively few complaints against the police department every year. In 2020, there were 2 complaints. In 2019, there were 8 complaints. And in 2018, there were 2 complaints. So we're really not talking about a huge number. A lot of those complaints are about rudeness, but not all of them. Some of them are about more serious things. But the point here is that when it is necessary, in the judgment of these, not police officers, not town employees, just residents of Brookline who care and are interested in policing, to have an independent investigation, they would make that case to the select board, who are our directly elected police commissioners, and the select board would have sort of that perspective to help guide them in their decision making. So we think the PCAC is a really important and concrete step forward for improving public input and civilian oversight over the police department. It would be kind of both proactive and reactive. Reactive in the sense that it reviews complaints of misconduct against the police department and ensures that they're handled appropriately. And proactive in the sense that, this is a group of people who see themselves and are responsible for studying what the police do and formulating effective policies to mitigate bias in policing, and ensure that policing is done properly. And that can involve a lot of different things. It can involve attending training. It can involve surveying or interviewing members of the public or members of the police department, working with other town staff, studying what other departments are doing, and so on. But this is, I think, a necessary and important step forward in how the governance of the police department is done. And I think it is appropriately tailored to the issues in Brookline, where, just to kind of begin or end where I started, the select board really formally is on top. They have the power to oversee the police department, and occasionally, in some ways, they do exercise it. But in practice, they have a ton of other issues to oversee: housing, economic development, various personnel issues, planning and zoning, the environment, and so on. And so it's important, just as the select board has an advisory board to help them with housing, and just as they have an advisory board to help them with economic development, that they also get the support and expertise to help them effectively oversee the police department, especially right now where these issues are really salient and where we, absolutely do want to ensure that, racism and classism and bias and all these other kinds of things are minimized in our policing.
Can I just add one thing? Michael talked about the sort of low-level complaints we receive. And one of the great things about the PCAC is that it can actually intervene at the point that a complaint relates to something fairly minor, and set up processes to ensure that this problem doesn't escalate into something really, really bad. And I can think of a few examples that I've had to actually deal with over not just with the police department, but over the years, where people say things that are just not racist necessarily, but are just inconsiderate. The type of, maybe locker room type comments that people of a certain age, find easy to do, which can get a department into trouble, as it has in Brookline. But with the PCAC, they can, identify these small problems. It may not even result in a complaint, maybe some feedback in Ron's feedback form, and actually intervene and say, we need some training, not in some fancy anti-bias stuff, but just, alerting people to the fact that, the type of talk that sometimes occurs, around the station house or whatever is not appropriate and should stop. Many times people don't even realize that it's not appropriate. And it's not just police, it's all of us. And
I mean, there are a lot of incidences, I believe, that from my interaction with young people in Brookline and with teachers in Brookline and METCO commissioners, and that, there are incidences that are, what I would consider more than minor. And this is either for you, just if I could just get like a quick answer to this. So with this PCAC, Police Commissioner Advisory Committee, would if someone has an issue with a police officer or officers, would they go to the PCAC first, or would they go to the police department first, and then, if they have an issue, then go to the PCAC?
Yeah, so we have it set up so that they can go to either place. They could also go to the diversity office. There are and frankly, in the stat, and right now they can go to the select board as well directly if they want to. So that all these different places can accept complaints, and all of those different offices would have a role in making sure that they're addressed appropriately. So if it's a police issue, the police department has a role in making sure that the misconduct is corrected. The PCAC has a role in making sure the misconduct is corrected. And also the diversity, the Office of Diversity, one of the other proposals that we've come up with is that the Office of Diversity should, the town should give resources to the Office of Diversity so that they can provide a staff person, a liaison, who can assist people in filing complaints against police officers. I think you kind of alluded to this, and it's definitely the case that not all instances of police misconduct result in a complaint. Many people don't complain for a variety of reasons. This isn't unique to Brookline, but it surely happens in Brookline, that they don't think anything will happen. They think they might be retaliated against, or they just don't get it. I mean, the process is confusing and kind of intimidating, especially at the very moment where you feel like the police have treated you poorly. It takes a lot of courage to then go up to the police department and say, you should do something about this. That's tough for people. And so, and understandably so. It's not like sort of hard to imagine why. And so that's a challenging situation, but we did develop some concrete recommendations to at least try to mitigate those problems. Ron alluded to this, but one change that we got and is already been implemented is that now you can file a complaint against a police employee online through a web form, whereas previously that was not an option. You had to print out a form and hand deliver it, or you had to show up to the police department, or if you knew that you could, but I doubt most people did, you could show up to the select board's office and file it there too. Now we have a process where you can file it directly, on a phone or on a computer without leaving your house. And especially during the pandemic, that there are lots of reasons why you might want to do that. But that at least lowers the cost of filing a complaint. And then also we think that the diversity office should support people who file complaints by providing them with a person we're calling a diversity liaison who, helps them articulate what their complaint was, explain the kind of confusing complaints process, or sometimes confusing, and participate with them at interviews about the process if they want that to happen. And so this isn't going to solve the issue necessarily that you mentioned, but at least it's some concrete steps that make it easier for folks who feel that they've been treated inappropriately by police to raise that feedback with the department so that it's sort of identified and corrected.
Yeah, I'd like to sort of emphasize the small complaints because that's where you need to intervene and nip things in the bud. And the brilliance of Ron Wilkinson's community feedback back form is that this is going to be where the small issues are presented to us. Because many of these complaints that people will have, you don't go through the formal complaint process because people have other things to do and they're busy. They don't want the hassle. But the feedback form gives people a really easy way to say, I was stopped and there's nothing really wrong except the guy had on his lights constantly, and it really brought attention to me. I didn't like that. I mean, just things like that may not seem important at first blush, but do represent something that we should intervene and fix, or just tell people to stop doing. And the feedback form gives us the opportunity to do that.
I've never said this publicly, but I was on the receiving end of what I believe was some police misconduct, and it was I filed a complaint, and I can tell you, I know a lot of people in Brookline. The first person I called was Mel Klechter, the town administrator. Not everyone in Brookline can call a town administrator, even know who he is, and have them actually talk to him. And I was so rattled. I was in tears, and I was on the street in Washington Street it just happened right near the police station. I went to, I didn't know if I was filing a complaint. I just knew something really bad had happened. And I can tell you, being someone who's perceived as white, I'm Jewish, so I say perceived as white. White supremacists would disagree with that, but it was so difficult to make that step, to say something about it. And then I also reported on something where an off-duty officer intimidated a group of students of color, and the ex-wife of the officer was in the car and started hurling racial epithets at the students. And we reported on that, but it was a case of the students didn't want to say anything, and their social worker at the high school for Steps to Success contacted me instead of the police. So coming to the police is so intimidating. I was raised to be respectful of the police, even though I felt like I was, what happened was I rented an office, and the person who was in the office next to it thought that he was going to rent it, and I paid $3,000, and I made an agreement with the landlord, and I'm a man in khakis and a dress shirt with a tape measure measuring out this new office, and the person next door told me to leave. I didn't want to leave because I paid $3,000 to be there. And it was about 4 doors down from the police station, and about 7 or 8 police officers ran in and dragged me out. They didn't drag me, but they physically intimidated me. And when I tried to call a town commissioner, a town administrator, they told me they would smash my phone if I didn't put it in my pocket. And I was on the street and they were around me, and I don't think they were gonna strike me, but I was scared, and I was also embarrassed. And I also thought that someone might drive by that could be one of my clients or something, or the public could see that I had done something wrong, and I just wasn't raised to do things wrong. And even someone like that, to go to the police was difficult. And the way the process played out, in both these instances, it was it was just slow played for so long that in the end, I just wanted it to go away. And in the end, these students just wanted their situation to go away. And so I don't know who I'm addressing this to, but you can all weigh in, but just, it really is a massive barrier to, especially if you believe that the police, you're respectful of the police. The first thing that, when I did complain, I got a call later saying that basically there really wasn't a problem because the officers said they didn't have any issue with me. Even though I didn't even try to file a complaint. I just wanted the police to know this had happened. And Mel Kleckner and office chief of police, they were kind to me and everything and helped me through it. But not everyone knows the chief of police, and not everyone knows the town administrator.
Yeah, well, that's one problem that we hope to be able to overcome. I'd like to raise another problem that your story sort of suggests, and that is this neighboring office neighboring person called the police on you to settle what was looked like a business dispute. Well, one of the things that we learned about, I think most of us knew about this problem, but one of the things that our research brought up was the idea of civilian profiling, meaning people who call the police and say, "There's some black kids out here, come and get them," and the police are forced. They have an obligation to come to that or to do something. And if they go out and meet the kids who are complained about, then they are accused of the profiling, even though it was a civilian who actually did it. A funny description of this in one of our meetings was someone called about hooligans doing shenanigans out in the community. I don't know that they're black hooligans, but the point is that that happens a lot, and the police get blamed for this. But it's really a problem within our community that our report talked about and had some recommendations for dealing with.
It's a tough discussion because I know a lot of police officers, and there's so many great ones, and where I think that a lot of the public is empathetic of police officers that feel that they're under attack. There's also this history of police misconduct, and and a lot of people who support the Black Lives movement feel that the Blue Lives Matter movement is a negative reaction to their demonstrations. And so it's a difficult discussion. Dr. Childs, just want you to weigh in any way you want to.
Well, I thought your story, Harvey, was really important because it talks about how much courage it takes as a community member to step forward to make things better. And I think that everybody in the community these are our police, right? They're part of our community. So it does take, we do want to make it easier for people to step forward and bring up things that could really be better in the police, because we know, and the police know, that things can be better. That was one of the things that came out in the survey of the police, is that many of them had many excellent recommendations for them to be a better department, for them to be a better force. And I think that culture of we can do better is, we want to hold on to officers who embrace that. Like, we're not perfect. We are imperfect humans trying to help other imperfect humans. And we know that. So yes, there are police that should be held accountable, and we should absolutely, there should be no question that we hold people accountable who are doing things in a biased or unjust, cruel way. They should go. But there are a lot of people who are trying their very best, and I think we want to see that on both sides of the community, both in the community itself and in the police department. And that's why it's so important that the community and the police work together to move the police forward. And the police, if their morale is, if they only feel attacked, then why would you try to be better, right? I mean, how do we help people get better? We help people get better by embracing them as, you can do this better. You can do this better. And we will work together to do it. And I'm not talking about not holding people accountable. I mean, the rogue cops, we need to hold them accountable. That's not acceptable. It's just not, it's not human dignity. It's just basic human dignity. You don't treat people like that. But the vast majority of the cops in Brookline, at least, really want to do a great job for the community. Many of them grew up here. They want to give back. When you actually look at the police survey, and then you look at some of the task force stuff, it's amazing how much synergy there is with that perspective. So I think it's a bit of trying to help the community understand that their role to play here is to help bridge between what we do. And actually, your example is so powerful, because here you are in the throes of something that's incredibly frightening and embarrassing, and you're like, I don't know what to do, and I'm trying to get help here. And it takes a lot of guts to like make that call.
Thank you, Bernard and Dr. Childs and Michael and Ronald for joining me today. This was a great discussion. We're going to be talking a lot more about it. If you want to hear more about the discussion, there'll be another part of this, and you can go online at brooklinehub.com and you'll hear the entire discussion. Thank you for joining us.
Hi, my name is Danielle Myers of ADW Video Productions and BrooklineHub.com. BrooklineHub.com is a 501c3 nonprofit online publication dedicated to community building through local reporting and events. Brookline Facing Civil Rights was produced by our founder, Harvey Bravman. The film is about the experiences of African Americans who helped break the wall of segregation that existed in Brookline before the civil rights laws were passed in the 1960s. Last year, the film sold out the Coolidge Corner Theater and included a panel discussion on inclusivity. You can stream the film and the discussion on BrooklineHub.com in exchange for a donation to the Brookline Community Foundation's Safety Net Fund. You can also stream Soul Witness, a film that features interviews with Brookline Holocaust survivors conducted 30 years ago, on soulwitness.org.